videos, footage from the Kotoka International Airport, where just a couple of minutes ago, the Emirates aircraft carrying the 600,000 vaccines expected in Ghana landed and is currently taxiing. We can see it making its way to the Terminal 3. We are here at the Terminal 2. The vaccines will be delivered at Terminal 3, I understand.
Yes, I understand. And then will be sent there and then brought samples, or a piece of it will be brought here to make the symbolic presentation, I would suppose. And then the rest of it will be safely transported under the right temperature to the storage facilities that have been designated. So like we said, the health minister designate is here. A team from UNICEF is also around. All Ghana's health partners, the Ghana Health Service, very, very much represented. All of Ghana's health partners are here to ensure that this is done safely. The aim is to assure you and I that these vaccines are for our own good, and it may be in our best interest to opt to get vaccinated, because Abdul, the law does not mandate or compel anybody to be vaccinated against their will. So people have to be willing to take the vaccine. And that is what the officials are counting on in the next few days, to build up that professional, competence, so that people will have trust in the vaccine, and then
and there's international interest in the arrival of these vaccines as well. UNICEF already, we have indicated to you, is playing a key role in the arrival of these vaccines and the acquisition of these vaccines as well. Indeed, Thelma did make a point earlier regarding the fact that when the vaccines were first produced in the Western world, in Europe, in America in particular, it appeared that Africa had been forgotten, and the distribution was focused on persons within these continents and countries that particularly were not as vulnerable to the virus as other people in Africa were. But agencies such as UNICEF came in and have ensured that there is equitable distribution of the vaccines so far. 600,000 have come into Ghana. We're expecting a lot more to arrive in the coming weeks and months.
Because mind you, the president has pledged his commitment to ensuring that all Ghanaians are vaccinated. We are talking about 31 million people, some of whom may be initially excluded from being vaccinated. For example, children who have not been trialed with any of these vaccines, and so the effect on their livelihood has not been ascertained. So we know for a fact that children are not going to be vaccinated, at least at this initial moment. There may be other groups of people who, though may be willing to be vaccinated, cannot accept the vaccine because of one or two reasons. And this is outside of those who refuse to take the vaccine for no reason. So we do have a Herculean task ahead of us.
That's very true.
To achieve herd immunity.
And that's why I earlier made the point that even as the vaccines arrive, we should not become complacent, because even if the distribution started today, it would not get to every Ghanaian immediately.
And what the studies have shown us also is that even if you do get the vaccine today, you do not get automatic immunity. So the foolproof way still remains social distancing, wearing your mask, washing your hands with soap under running water, and then basically keeping to the protocols, avoiding crowded spaces, because there have been instances in the West where people have received the vaccination and have still gone on to be infected. However, the plus side for them is they do not get as sick, and they report even milder symptoms because their bodies have been exposed to a system which allows antibodies to be produced.
And you mentioned the issue of children. It's instructive to note that just about 2 or 3 weeks ago, the Akufo-addo Teaching Hospital in particular did make all of us aware that its children's ward had been inundated with cases of COVID-19. Indeed, at the time, we're told that some children had lost their lives, at least 2 had lost their lives as at that time. But previously, we never heard cases of children contracting the disease, the virus in the first place, and to go on to die was very unfortunate. That the new variant appears to be affecting these children. But unfortunately, they cannot be vaccinated, at least not now. What it then means is that even when the vaccination starts rolling out, we still need to protect our children as well. We do, and you would also recall that the Ghana Education Service, as part of measures to protect these children, made the very, authoritative decision not to go ahead with any of the 6th March Independence Day activities. 6th March is very dear to the country. It is when we got independence, and children, for as long as I have been around, have looked forward to those activities, to march and, give Ghana a little bit of what Ghana has given to them. But all those programs and other related activities to the Independence Day activities have been cancelled. It tells you that the situation needs to be brought under control somehow, and we have to let go of some of the things we love most so that we can protect ourselves to be alive to enjoy them in future. Thelma, to our left there, we've seen the government delegation led by the Honorable Minister Designate in charge of health, and you have already told our viewers that indeed he has been in charge of health for the last 4 years. But again, particularly in the fight against coronavirus, he's been very, very instrumental, to the point where at a point he himself was reported to have contracted the virus. But thanks be to God, he has recovered and has continued working effortlessly and hard working towards bringing this virus to close, so to speak, Thelma. So we also find some members of the diplomatic corps together with the government delegation currently conferring with each other. I'm sure that they are all excited that finally there appears to be light at the end of the tunnel, that this pandemic will eventually be fought and the battle will be won. I'm very expectant as well, Abdul, and I'm very excited to see the collaboration that the government and people of Ghana have received from their development partners. We can see representatives from the U.S. Embassy. You can see their vehicle and their flag prominently here. You can see some delegations also from the UK High Commission, and then obviously, as we've said, UNICEF, and they've worked hand in hand with the COVAX team that was put together by the World Health Organization to ensure equitable distribution of the vaccines. As at now, we understand that only 20% of Africa's population has been vaccinated, and those numbers are very low indeed when you compare them to places like the UK, where about 17 million people have already been vaccinated in the past 3 weeks, and in the US, where a lot more people are being vaccinated and being offered the vaccine. So indeed, hope has arrived, I would like to believe, Abdul, and I'm excited to see the collaboration and the dedication with which we are getting support to fight this battle. Exactly, and again, we having to go back to the genesis of the virus and what the government of Ghana has been doing to ensure that its spread is kept, so to speak. We go back to the weekly press conferences. In fact, every week there are 2 press conferences since March of last year to address issues relative to COVID-19. You believe that in some way has helped to keep the numbers where they are now, even though we are complaining that well, we've recorded too many deaths? Yeah, and the other thing that I believe those press conferences have achieved is also to help us with misinformation and conspiracy theories that have surrounded the whole pandemic since the World Health Organization declared it a global pandemic in February of last year. So it has helped us to know what is right and what information is not right and which ones we should disregard. I remember when the coronavirus scare started and people started drinking all sorts of medical concoctions. The Ghana Health Service, through those press conferences, for example, had the opportunity to engage with people who were well-knowledged, well-learned in those fields, to tell people what to expect, what to do and what not to do. Because we've learned from the experience in China that they have used certain systems that have worked for them.
And so people were suggesting that we could try those as well. But the Ghana Health Service has guided the public reactions and the public access to information as much as they can. But social media has not made that easy, Abdul, and we still constantly find false information and fake news carrying such false messages.
And we see that the security personnel, all is about set now, indicating that we need to relocate in order to do their work safely, so that the vaccines arrive safely. We also need to stay safe anyway, so we will relocate whilst giving you all the information from behind the cameras, telling you all about what to expect as the vaccines are received. Just a little bit of background information that the flight carrying about 600 doses of the AstraZeneca, 600,000 doses of the AstraZeneca Oxford vaccine produced by Serum Institute of India has landed in Ghana's capital here in Accra. This delivery, of course, we know comes almost a year after the WHO first described the novel coronavirus as a global pandemic, and 8 months after the launch of the COVAX initiative, which was aimed at pooling funds from wealthier countries and non-profits to develop a COVID-19 vaccine and distribute it equitably around the world. Ghana has seen the arrival of the vaccines. The airliner carrying the vaccines landed about 10 minutes ago, is it? Yep. Yes, and we are now awaiting the
doses
to be transported from the aircraft to where the VIPs have gathered to receive them. We do understand that subsequently the president will be the first gentleman, of course, that is to be expected, the first gentleman to receive the vaccine.
I think the information is to start from the 37 military hospital, barring any hitches, and then they're expected to be transported possibly to other health centers to give greater access to our priority at the moment. And the first point of our vaccination plan is to get our frontliners safe and protected. So the plan is to give them the first dip. And so we're expecting the healthcare workers and frontline security personnel and persons with known underlying medical conditions, and then persons who are 60 plus and older will get the first initial opportunity to be given the vaccines. And we expect that a more detailed plan of what that entails will be unraveled later when the officials are able to make the speeches and make that information available to us. Of course,
yes. The rollout plan in Ghana is a milestone for the initiative that is trying to narrow a politically sensitive gap between the millions of people being vaccinated in wealthier countries and the comparatively few who have received shots in less developed parts of the world, including Ghana. We know that the AU has been trying to help the 55 member states here in Africa buy more doses in a push to immunize at least 60% of the continents. And Africa is actually made up of 1.3 billion people. That's a little lower than the Chinese population alone, and lower than the Indian population alone as well. But do we know of the vaccine and how it works in China as well? You know, all of this conversation started when coronavirus was first identified in the Wuhan city of China.
So China was initially getting, bad press a lot for the outbreak in the first place, and they faced allegations and accusations of not alerting the international community early enough to be able to put systems in place to curb further spread of the virus. But Abdul, if you would also recall, China, or news on China, has been largely very, very and forthcoming. So not much has come out from China in the past maybe 6 to 8 months, until recently when the WHO sent a team to investigate the start of the pandemic. And it tells you that largely, as we followed from the international press, that China has succeeded in managing its cases and is still, even currently, implementing strict measures, including quarantine, to keep those numbers down. So something certainly is working for the Chinese.
Of course,
that the world is learning from.
Still talking about China, and the vaccines in Africa. China has actually sent vaccines to Zimbabwe and to Equatorial Guinea as well, and they have started rolling out a program to ensure that everybody is vaccinated. And so China hasn't gone to sleep at all.
And they've always displayed their willingness to partner with other countries and other delegations from around the world to find us a collective end to this collective problem that we all face. Remember that even Ghana has benefited from donations from, for example, the Jack Ma Foundation.
Yes.
They brought us PPE, they brought us other supportive, intellect or intelligence to bear on our fight against COVID-19. So we cannot remove China from the equation, and they continue to throw in their support in the fight.
Yes. So, Thelma, you have, as we say in the media, intercepted, stumbled upon some information regarding the vaccination rollout plan, which we believe has been approved by the FDA. Again, this is just something we have stumbled upon. But we just feel that our audiences need to know about it as well. So you may want to...
When we initially got the information, there was no confirmation from anywhere. But on Friday, when the Ministry of Health and its partners, i.e. the Ministry of Information, and then UNICEF, COVAX, and the rest, met at that very important press conference to talk about the rollout plan for the vaccination, they did let us know that the coverage would be for 260 metropolitan, municipal and district assemblies, and that there will be 12,500 vaccinators involved with 2,000 supervisors, and they're expecting nearly 40,000 people to volunteer in this rollout program. So we are getting 2 FDA-approved vaccines. The FDA has come out to say they are safe and they will do the job, because there have been concerns that one of the vaccines may not be as effective against the new variant of the coronavirus. But the FDA has been quick to allay those fears and to say that, look, some protection, which is in this case is over 70%, is better than 0% protection at all. So people should have hope in the system that the vaccine will do what it's supposed to do, as we've seen in countries like the UK, where studies have come up recently, just in the past week or so, to show that vaccination has been one of the key things that have helped them to manage their cases. Okay,
so right now, I'm sure you're seeing on your screens the vaccines as they are being transported from the Emirates aircraft to the VVIP lounge here at the Kotoka International Airport, specifically Terminal 2. And we have a statement from the Ministry of Information regarding the arrival of these vaccines. Thelma might want to read that for us, even as we observe the arrival of the vaccines, 600,000 of them, we have been told. Thelma, what does the ministry say concerning this?
So here's a statement signed by the President's representative at the Ministry of Information, the Honorable Agyapong Kroma, and it's a statement on the arrival of the COVID-19 vaccine in Ghana. And I'm going to read this as I received it. It says, the government of Ghana is taking delivery of 600,000 doses of AstraZeneca COVID-19 vaccine made by the Serum Institute of India, Covishield, today, February 24, 2021. This is the first consignment of vaccines acquired through the COVID-19 Vaccine Global Access Facility, COVAX, which Ghana, among 92 countries, has signed on to. COVID-19 vaccination will be conducted in phases among segmented populations. The first segment of the population that will receive from the 600,000 doses will be health workers, adults 60 years and over, people with underlying health conditions, frontline executive, legislature, judiciary, and their related staff, frontline security personnel, some religious leaders, essential workers, teachers, and other personalities in Greater Accra Metro, including Ewutu Senya and Ewutu Senya East in the central region. A similar segmented population in Greater Kumasi Metro and Obuasi Municipality will also be covered. From March 2nd, the COVID-19 vaccines will be deployed in health facilities and designated centers in these geographical regions. The government of Ghana remains resolute at ensuring the welfare of all Ghanaians and is making frantic efforts to acquire adequate vaccines to cover the entire population through bilateral and multilateral agencies. We urge you to do your part by ensuring that you get vaccinated when the vaccine gets to you. We acknowledge the hard work of the technical teams from the Ghana Health Service, the Ministry of Health, the Ministry of Information, the COVID-19 Task Force, and all those who have assisted in getting us this far. Our development partners are also acknowledged for their tremendous financial and technical support. It is our hope that they will continue to support in our sustained efforts in combating this virus and putting COVID-19 behind us. That's the end of the statement, Abdul.
And I can hazard a guess as to what informed the choice of those geographical locations. You recall that when there was a lockdown in parts of the country, some of these areas that have been mentioned in the statement actually came up. I mean, where some of the areas that were the hotspots, and so they went under lockdown, partial lockdown. It is therefore not surprising that they have also come up some of the areas to receive the first doses of the vaccine. But the minister designate for health, as well as some government officials, are currently about to receive the vaccines that just arrived. 600,000 doses of these vaccines. And so the good news is that what it means is that at least in the next few weeks, 600,000 Ghanaians, vulnerable Ghanaians and persons who are in frontline essential workers. Do journalists fall within this? If we do,
we'll wait for Honorable Agyapong to send a tweet, maybe like he did the last time, and for the avoidance of doubt, journalists are considered frontline workers. So it remains to be seen whether we do get cover up, though. But it's refreshing to note that the Accra and the Greater Kumasi metropolitan areas and Ewutu Senya would be priority focus areas because they have had more cases, and so the attempt to make those areas a priority would be in line.
Which one? Give it to tell. All right.
Yes, so it stands to reason, like you said, that these areas should get mention. And as the statement has said, persons with underlying health conditions will also get priority. So at this point, it remains to be seen how that will be determined. I will assume that there has to be some form of medical record that confirms that a person has underlying health conditions. We've been told that persons who are diabetic, persons who have high blood pressure, maybe low blood pressure, people who are asthmatic, and people with other health conditions may be the ones to benefit in that vein. Right. But it remains to be seen how proof of that would be acquired in order to confirm that one indeed is making a legitimate claim to the virus. Because in other countries we've seen instances where people who are deemed as not vulnerable have been offered the vaccine and they've taken it, and it has led to uproar. Because, for example, those at the front line and those with
very auspicious handing over the vaccines and the
designate. We must remember that until he is confirmed, the minister designate for health about to receive the first doses, 600,000 of them, and he's about to make a statement now.
The COVID facility and the partners, to thank all of you for your generous contribution that has led to this donation that we are receiving today through the COVAX facility. Ghana has led the way, and we can only say on behalf of WHO and the Director General Dr. Tedros and the Regional Director Masidiso Moeti that we hope
statements right now. We will summarize whatever the minister says subsequently to you, but just a quick reminder that a flight carrying about 600 doses of the 600,000, why do I keep saying 600? It's actually 600,000 doses, and the good news is that in the next few weeks, what it means is that at least 600,000 vulnerable and exposed Ghanaians will receive the vaccination, and so 600,000 of us will be free of the virus, and that for me is very good news, but also because we still need to keeping safe, keep washing our hands, using the hand sanitizers, and of course wearing the face mask, and keeping that social distancing we become used to. There's another statement.
Yes, Abdul. The WHO and UNICEF have issued a joint statement, and that has just been forwarded to me by the Office of the Ministry of Information, and it's saying the heading is Ghana becomes recipient of historic first shipment of COVAX vaccines. And the statement reads, after a year of disruptions due to the COVID-19 pandemic, with more than 80,700 Ghanaians getting infected with the virus and over 580 lost lives, the path to recovery for the people of Ghana can finally begin. This is a momentous occasion as the arrival of the COVID-19 vaccines into Ghana is critical in bringing the pandemic to an end. The only way out of this crisis is to ensure that vaccines are available for all. We thank all partners that are supporting the COVAX facility to deliver safe and effective COVID-19 vaccines to all countries quickly and fairly. These 600,000 COVAX vaccines are part of an initial tranche of deliveries of the AstraZeneca Oxford vaccine licensed to the Serum Institute of India, which represent part of the first wave of COVID vaccines headed to several low and middle income countries. The shipment also represents the beginning of what should be the largest vaccine procurement and supply operation in history. The COVAX facility plans to deliver close to 2 billion doses of COVID-19 vaccines this year, and this is an unprecedented global effort to make sure all citizens have access to vaccines. We are pleased that Ghana has become the first country to receive the COVID-19 vaccines from the COVAX facility. We congratulate the government of Ghana, especially the Ministry of Health, Ghana Health Service, and Ministry of Information for its relentless efforts to protect the population. As part of the UN country team in Ghana, UNICEF and WHO reiterate our commitment to support the vaccination campaign and contain the spread of the virus in close cooperation with all partners, including Gavi and the Coalition for Epidemic Preparedness Innovations, CEPI. Vaccines save lives. As health workers and other frontline staff are vaccinated, we will be able to gradually see a return to normalcy, including better access to health, education, and protection services. In the spirit of universal health coverage, let's leave no one behind. So that was the joint statement by the WHO and UNICEF. Congratulating all parties involved, basically, Abdul, and happy to see that we, the gateway to Africa, Ghana, is the first country to receive the shipping or the supply from the COVAX facility.
Yes, but just to also remind our viewers that but in Africa, Zimbabwe and Equatorial Guinea have already received some vaccines as well, but not from the COVAX. We needed to clear that before people think that we yes, but the rollout in Ghana is a milestone for the initiative that is trying to narrow what people call a politically sensitive gap between the millions of people being vaccinated in wealthier countries and comparatively few who have received the shots in less developed parts of the world, whilst others have received many more vaccines. Yep. We are now receiving our very first tranche of about 600,000, and remember our population is estimated to be about 31 million at the moment. So 600,000 is, even though it's exciting news, it's just like a drop in the ocean for now. And what it then means is that we must, there's still a long way to go. We shouldn't throw caution to the wind, and we must continue to observe all the safety protocols we have so much become used to in the last couple of months. It's almost a year now. We got our first case, I believe, in March. That was on the 12th of March, where 2 cases were imported. Indeed, for a long time, all the recorded cases in Ghana were imported cases until we began to see some form of community spread, and it has gotten worse ever since. Well, as we said at the very beginning, throughout from March until December last year, we had just about 350 or so persons who had passed away. Unfortunately so, but given the figures that we had seen from other countries, where in a day, in countries like the US, about 1,000 people could die. In fact, in one of the days, in the US alone, 1,200 people died. In Brazil, in one day, 900 people died. In Spain, in one day, and I'm talking about not just one day, but subsequently other days, you have 800 people dying, 900, 1,000 in Spain, in Brazil, in Italy. We had 900 people dying for almost 5 consecutive days, Thelma. And so when we had about 300 for the entire 8 months or so, even though it wasn't exciting, we still we were lucky. We said we were lucky. But in 2 months, we've lost as many people as we lost in the entire 2020. That's unfortunate, Thelma.
That is the cause for worry. But Abdul, all is not lost. Hopefully, as we learn more about this new disease, and as we adapt to ways to cope with this new normal, some sense of normalcy will return, like the statement from the WHO and UNICEF said. Mind you that in America alone, just over the weekend, they marked the 500,000 deaths in America alone, and they held a ceremony, a minute silence to remember those who had fallen. In the whole of Africa, we've lost about 100,000 people, and that is only a fifth of what America has lost. It is in no way meant to take from the grief that people feel. And I've said on some platforms that COVID-19 has ceased to be about figures and numbers, and it's now people I know, people you know, people who are getting infected are people that you know. Now it's in the communities. You are seeing the people. You saw somebody last week. This week the person tested positive. You have instances where prominent personalities have come out to say, look, I have tested positive. Unfortunately, we still have stigmatization of persons at workplaces, within the community, of persons who have recovered from COVID-19 being, discriminated against for whatever reason. And that I find very unfortunate, because at least those people have known their status. At least they've tested, and at least they've gotten help. But what about those who have not tested, and yet they sit in the safety of their ignorance, if I can call it that, to look at those who have bravely gone to test and they have received the treatment and think that they, for some reason, are better.
I find that very contradictory, that someone goes to test and probably tests positive, and another person who actually declines to be tested begins to stigmatize that person who has tested and is actually not showing any signs and symptoms of sickness and so on, yet You sitting there, you are feeling symptoms. You have some symptoms of illnesses, and yet you haven't tested. Yet you are stigmatizing somebody who has tested positive. The person is safer than you who have not tested, and therefore the stigmatization must stop. Indeed, everyone must be encouraged to go out there and test, and if found positive, get some treatment and get everyone else to be safe, rather than staying away from being tested and putting the rest of us at risk. Currently, the cold stores, the mobile cold stores are ready to receive the vaccines. Of course, the Minister Designate for Health and his entourage, as well as the international community here in Ghana, have, and representatives from UNICEF and the WHO have all witnessed the arrival of the vaccines, have received them formally, and these vaccines will now be transported to other holding facilities in wait for the president to officially receive them and also be the first to be vaccinated in the country before the rollout plan is actually activated. So the vaccines, 600,000 of them, 600,000 have arrived.
Right. And we can see that as the trucks are being loaded, some of the delegation have started to leave. It tells you that we've come to the end of the official welcoming of the vaccines into Ghana. We are live in the capital, Accra, and we are at Terminal 2 of the Kotoka International Airport, what used to be our international travel terminal until we got a new facility at Terminal 3, and then the international travel was moved to that building. So we've seen Health Minister Designate receive the vaccines with his team from the Ghana Health Service and also the world partners from UNICEF, WHO, COVAX, and all those who have come to support us. Indeed, they have the eternal gratitude of a nation, because finally we may see some light at the end of what had appeared to be a rather dark tunnel. And for those who have lost their lives in this fight, we can never forget what you've had to sacrifice for us to gain knowledge of how to live with this new disease as we go on in the weeks and months ahead. And we cannot also say thank you enough to the COVAX team who have spearheaded this acquisition of the vaccines, because it is very competitive and a lot of countries are fighting to get vaccines. And for Ghana to be the first in Africa to benefit from the facility is really welcome news for its citizens, and we hope that the whole of Africa, indeed everyone everywhere in the world who desperately needs a vaccine in order to be safe and to survive, will get one sooner rather than later. And I'm also
again, Thelma, just to cut in there, as you talk about Ghana being the first in Africa, we always need to emphasize the fact that we are referring to the COVAX, the COVAX, and not because other countries have received some other forms of vaccinations, but Ghana is the first to receive the COVAX vaccination facilities. That clarification, we need to keep making it before somebody misquotes.
Have started in other African
Zimbabwe, Equatorial Guinea,
even in South Africa. On the 17th of February, they started some vaccinations. So mind you, South Africa had to get new vaccines so that they can deal with their new strain. The vaccines are being loaded, and we can see that on our screen. Very historic things we are seeing here, Abdul. The end in sight in our COVID fight.
Of course, but again, we keep cautioning Ghanaians that this does not mean that we lower our guards. We are not out of the woods, not yet. And even for those who will be privileged to be among the first to receive the vaccines, it does not guarantee you against contracting the virus 100%. You still need to stay away from all the issues that can lead to a contraction of the virus. And that's what is important, that as much as possible, let's stick to all the COVID-19 protection protocols, even as the vaccines have arrived, and even as the rollout will start after the 2nd of March, when the president initially officially receives them and proceeds to give us the rollout plan.
Yes, I'm excited for, particularly, obviously I'm excited for the whole country, but the people who are top of my list is for the frontline workers and all the people in the health sector generally, who have been at the forefront of this fight, bravely fighting to protect the rest of us who are now referred to as mere mortals, because those people are heroes. They have saved the country a great deal of human resource, and they deserve every commendation that comes their way. I'm happy that with this vaccination, once they get it, they will have an extra layer of protection, because we know that the distribution of PPEs, from what we've been told, have not been at 100%, and we look forward to seeing the numbers become better, so that as we move on to other things to do in the country later on in the year, we'll be more confident of safety.
That's right, and even as you will talk about, you have spoken about frontline workers. You recall that when the president initially gave out some incentives to frontline workers, all manner of people came out to define themselves as frontline workers. I just hope that that controversy we experience will not happen this time around, and that the proper definition for frontline workers would have already been put out there for people who know that they belong to that circle or not, not to come out to create any unnecessary controversies, even as we receive this very exciting news.
Yes, I think that apart from the key people for me being frontline workers that I'm excited for the persons in the upper age demographic who have been identified as being vulnerable, so the 60+ population. I'm excited that my grandmother at home will have access to a vaccine. Your father and your mother, who is advanced in age, will have access to a vaccine. I'm hoping that people would see the benefit of being vaccinated, and so turn up en masse to take the jab, because we've seen other countries where people who have refused the vaccine have been offered alternatives which have been costly. What do I mean, Abdul? A friend of mine who lectures at the university in United Arab Emirates has been told that they needed to get vaccinated or pay for tests every 2 weeks from their pockets.
Wow.
So if you refuse to get the vaccination, you had to pay for the test yourself. And I'm hoping that it will not come to that point, and that everything that we are seeing today will be reassuring to the public, Abdul, so that they will be better informed to go out and be vaccinated. I'm excited at the level of partnership that we've seen here today from our development partners, and I'm hoping that the Ghanaian people would rally together, as we always have, to make this vaccination dream a reality and a success.
All right, and so Thelma, I think that's about it for now. For those who just joined, those are the vaccines getting onto the trucks to be transported to some other storage facilities for the rollout proper to be activated. 600,000 of them arrived in the country about some 30 minutes ago on an Emirates airliner. The Minister for Health designate and other government officials were here together with UNICEF and WHO officials to receive the vaccines, and now they are being dispatched to some other storage facilities. That's about it for now. We will ensure that we'll bring you all other information you need to know, you need to have concerning these vaccines and the rollout plan. We'll let you know, especially for those of you in the brackets that have been defined in the rollout plan initially. Thomas, this is where we wrap it all up.
Certainly, Abdul. So the WHO and UNICEF, they call it a historic moment for Ghana, because finally 600,000 doses have appeared for a population of 31 million. That may not seem like a lot, but it is a start, and we are hoping that in the coming days more information will be available, as Abdul said. And we want to say a special thank you to obviously all of us gathered here, all those who have made this possible, the international community and all the health partners who have partnered Ghana to make its people safe. And as we call it a wrap from the Kotoka International Airport, we want to entreat you to still keep adhering to the safety protocols. Wear your mask whenever you step out of your house. Wash your hands with soap under running water. Maintain a physical distance from people, especially those who appear sick or exhibit the symptoms that you know of: coughing, sneezing, shortness of breath. Also avoid crowded places and ensure that you protect the vulnerable people around you, that is children, the elderly, the sick, to ensure that we all win this collective fight, because the end is in sight, and if we play our cards right, we will beat this.
Well, more importantly, again, for me, do not stigmatize people who go for the test and test positive. When they test and test positive, it's actually for the good of you and I who have not tested. Thank you very much for being a part of this coverage. We'll continue to update you on everything concerning the vaccines as they have arrived. Have a very good morning. Bye-bye.
Bye for now.